everyone, I'm Dr. Loharan. I'm the owner of Anatomy Chiropractic and a board-certified upper cervical chiropractor. We've been using the Erchonia GVL laser on our patients in our clinic, and I wanted to share with you a really cool success story. In a previous video, I discussed the potential effects of the GVL laser on patients with arthritis. Here's a screenshot of the study that I discussed in that video. It basically says patients who suffer from arthritis can benefit from increased mitochondrial support. And as you know, the Erchonia lasers directly affect the mitochondria. Basically, the light stimulates more production of ATP, which comes from the mitochondria. Additionally, there have been other studies discussing the potential effects green laser has on bone healing and repair. So we have been using the GVL laser in conjunction with our normal adjustment protocols on patients who have neck pain as well as present with arthritic changes in their neck. And this is a really cool pre and post x-ray I wanted to share with you. We have her pre-lateral cervical that we took, and I want you to pay attention to a few things. So specifically, these two vertebrae here, they look different than the others, meaning when we look at this line here, you see that it's really fuzzy. A normal vertebra should have a nice smooth line like this one here at C3. So these fuzzy lines are indication of arthritic changes that are currently happening. When bone starts forming, there's calcium being put down, and that creates that cloudiness that's in between, or that's along this line here. She's also having some bone spurs that are starting to grow. The one I want you to take a look at is this one right here. This triangle that is on the back side of her C6, there's not supposed to be bone growing in between there. That can potentially cause a lot of issues, especially when she's extending back, which is actually where she was having pain. So after 1 month of care with our normal adjustment protocols, as well as using the GVL laser, you could see that this same bone here, that triangle is not there. And you can see on this line here, it is much more smooth. There's no more cloudiness going on here and on the vertebrae above. Now, I have to say, this is a really rare occurrence, at least in our really limited sample size. She was the first person we used the GVL laser on, and it was really cool that she got this result. But we have found that patients who use the GVL in conjunction with another red laser get the best results in terms of reversing or healing their arthritic changes in their neck. I talked about another patient example in my video that I posted last week about the patient whose spine reversed in age after we did all of our treatment protocols on her. And I will link this video here and in the description below. So why is it that the GVL's effect on bone healing is more effective on some patients than others? We don't have a clear answer right now, but I hope this case study illustrates a possibility of this laser's potential. So whether you're a doctor who's looking to add the GVL to their clinic or a patient who has arthritis and is looking for a non-invasive way to treat their pain and possibly halt or reverse their arthritic changes in their neck, this is an option for you. That's all I have for you today. If you have any questions or comments, please leave them below and I'll get back to you as soon as I can. I'll see you guys next time.